I've done that with Joe Campbell.
Yeah.
All right, thank you guys so much for being here today. This is the 8th stop on our Democrats Deliver for Texas tour, and we're so excited to be in Madisonville, Texas, getting to highlight one of my personal favorite candidates, Susan Hayes, the Democratic nominee who's going to win in November for Ag Commissioner. I grew up down the road in College Station, so not too far from here, and to be able to be back in my home part of the state, my home zone, feels really nice to be here today. I specifically want to speak to why I think Susan's role is going to be so important in reshaping how we're supporting Texans. So I have been a longtime policy and politics junkie, right? But I never grew up in an area with a strong agricultural influence. And so therefore I always kind of ignored the position of agriculture commissioner because I didn't really understand the influence that would have on my life. I'm here today to tell y'all, don't sleep on that election. As it turns out, under that position, so one of the main positions of authority that role has is determining where the funding goes for Meals on Wheels and meals in children's schools, right? I was a teacher for 10 years. I can tell you from firsthand experience, when kids get a healthy breakfast and a healthy lunch, they are able to learn better. If you are being given junk food, you are not going to be able to have that brain sustainability to get you through the whole day. And so I think that it's just important that we go into this framing and listening to all the wonderful things Susan has to say to realize that there is a ripple effect to what the decisions that she can make will have. Because if we have better meals in schools, then we have better efficacy of learning in schools, and then we have better investment coming back to our communities with well-educated kids in the future. So Susan has lots of wonderful things she's going to be able to say to elaborate on this. I just wanted to introduce her and thank her for being here. Without further ado.
My name is Susan Hayes. I'm the Democratic nominee for agriculture, and I was raised in rural Texas and have understood for a long time it's Democratic policies that lift rural Texas up, while Republican policies are actively hurting rural Texas. First and foremost, that's over the issue of rural health care. Our hospitals have been closing by the dozens in rural Texas under the decades of Republican rule. We got a little reprieve with the COVID money, but that is going away quickly, and there are now many rural hospitals that are in grave danger of closing. I wanted to come to Madisonville today because this hospital is in danger of closing. The one next door in Crockett has been teetering on the brink. In addition, rural broadband. This county is hurting for rural broadband access. Same next door in Leon County. And those two things together can just strangle a community. If it doesn't have access to health care and now doesn't have access to the internet, which is a utility, everyone in Texas should have high-speed internet. With rural health care, let me explain why the Ag Commission is so important to that. As Whitney mentioned, a huge portion of the office is school lunches and Meals on Wheels. It's about 80% of the budget. But the State Office of Rural Health is also housed at the Ag Commission, in addition to rural economic development. Within that office, there was a grant and loan program to support rural hospitals, but the legislature has only appropriated a paltry $8.8 million of a 2-year budget cycle for that, which is pennies you find on the couch in a $114 billion state budget. And at the beginning of last session, the man I'm running against, Sid Miller, wanted to cut that paltry fund, of all things to do during the pandemic, which is why he has to go. When I am agriculture commissioner, the first thing I'm doing the next day on November 9th is getting on the phone to members of the appropriations and finance committees to get more money for rural health care. And then we've got to do a series of things to save rural health care in Texas. One, we have to expand Medicaid. The Republicans refused to do that because they wanted to spite Democrats. Right. And what the only effect on that was giving away our federal tax dollars to other states. Might as well put the money in a pile and set it on fire. There's no sense in that, and it hurt our own people to not take that money. Second, we need to encourage kids from rural communities like Madisonville or Crockett to go into nursing, to go to medical school. If you're from there, you might go back to practice there. And likewise have training programs from our medical schools. Right next door at A&M's medical school. Get training programs to put people who may not be from a rural area in rural communities to learn, and they're more likely to stay there to practice. Third thing we need to do is end health insurance redlining, which is outrageous to me that's even a thing. And in many rural community counties in the state, you only have one, maybe two options on the open market for health insurance. That's wrong. If an insurance company's gonna do business in the state, they need to do business in every county in the state. So that's why I wanted to come out to your community today to talk about healthcare, rural broadband, and let me tie those two together for you as well. The internet really can revolutionize access to healthcare. We don't have to have a specialist in every county because you can video conference with them now, but only if you have high-speed internet in every corner of your county. And those are the two issues that the Democrats will deliver when we're elected statewide. From Betho at the top of the ticket, all the way down to Ag Commission toward the bottom of the ticket. So spread the word, get people out to vote, and we can deliver some services to these communities that are hanging by a thread at times. And you know, I appreciate all of y'all coming out today. Happy to answer any questions, right, from the press or the people here who showed up to bear witness. Questions?
Okay, I have a question. So you was talking about grant funding, and you was also spoke about high school kids going back to school, trying to become nurses and stuff like that. So I know we have A&M, U of H. I mean, we got. Let me get my thoughts together. Right. I'm sorry.
Baylor, UT.
Yeah,
Yeah.
but that wasn't where I was going with that. Where I was going with like the hospitals, I'm talking about internships, the grant money that
Training
you was
programs.
talking about.
Yeah.
Is there a way maybe we can get the word out through your organization, through your office, I'm
Yes.
sorry,
Yes.
that maybe we can get rural communities to add that to their curriculum some kind of way, maybe, and maybe get those hospitals or whatever, throw out some of that grant money to fund maybe a kid doing some internship as a high school student or something like that.
A big role of the Ag Commission and any of our other statewide agency leaders is advocacy. That means going over to the Capitol to push for money, to push for legislative changes,
Right.
to support programs like this, working with our other public institutions like our universities to put programs into rural communities, and also spreading the word, letting people know what's available.
Right.
A big job of the Ag Commission is pulling down federal dollars.
Right.
So I can make sure we're getting as much money from USDA, which is where a lot of rural broadband money is flowing, down into Texas. But I gotta bang on the door and advocate. And then I gotta turn around and work to get that money implemented effectively in the community by putting together the right partners. And looking for gaps in coverage, what communities need healthcare the most, have the biggest distances to a hospital, to an ER, and what communities have the biggest gaps in broadband. And you get on the phone and you work it and get staff. So you work my own budget to make sure I've got staff overlooking those issues and looking for those gaps and how do we fill them.
We're about to lose our one doctor that's been here for 50 years, and I don't know what we're gonna do.
Is he retiring?
Who's leaving in either November or December?
Yeah.
And
Yeah.
His son is practicing,
But I heard the son doesn't want to come back.
no, he's practicing in Bryan College Station, apparently.
It's happening all over the state, particularly in rural communities, and particularly because of the stress of going through COVID, with so little support from Greg Abbott and the leadership in the state. I know in the community where I've been living, Alpine, there's one hospital for 3 counties with 25 beds, 3 ventilators. And they've lost about half of their physicians since the pandemic because the physicians were stressed out so much from having to practice outside their specialty, intubating people when they hadn't done it since medical school. And because of some of the flack that they got from right-wing elements in the community that were being fed by the rhetoric we saw come out of Greg Abbott's mouth and come out of Dan Patrick's mouth and come out of Ken Paxton's mouth.
These 3 men.
Yeah.
Can you speak more?
Right?
Can you speak more to how strong broadband supports hospitals and schools, but then also has a ripple effect into the economic prosperity of a community?
Absolutely. And, broadband is more and more the backbone of access to healthcare and to rural economic development. And I'll take an example from the community I've been living in. I'm seeing technology workers moving out there because they can work from anywhere and they enjoy being in a small town. The other piece of it with access to healthcare is so that people stay when they retire because they want access to healthcare. And if there's not a good hospital, you can't connect with doctors, people leave and go to the cities because they're worried about that. So you can really, the silver lining of the pandemic is it's changed how workers can work. And that's given small towns an opportunity if we have high-speed internet. I was very fortunate when my husband and I bought our land out in Alpine. Like the month we closed on it, here they came trenching to put in the high-speed broadband. So I was able during the pandemic to argue a case to the Texas Supreme Court from a really cool 1967 Airstream trailer that I used for my office up in the mountains. So I could work where I wanted to be. And there are others who can bring higher incomes into rural communities to do that. But we've got to have the broadband there and have to have more aggressive planning and looking for those gaps, assessing the resources, and then implementing them effectively to fill them.
I was having a talk with a citizen a couple months back on how he was born in Madisonville at the local hospital and how he knows that half of it is now condemned. I'm wondering what you can probably do to save that now, what he called it a condemned building, because half of it is not functioning as an actual hospital.
That's outrageous that the literal infrastructure has failed, that the building has condemned. Once upon a time, and in my hometown, this was true, a lot of hospitals were community run. My hometown hospital was a county hospital. It was converted to a private hospital in the 70s. And now it changes hands every few years. Because the economic model for rural healthcare does not work without expanding Medicaid. And that is because you have fewer people who are insured, and also because the reimbursement rates are lower. So without expanding Medicaid, rural hospitals will continue to fail and flounder. We've got to do it, and we've got to do it yesterday. So in these rural counties, most of them are represented by Republican reps and senators. So rural Texas needs to rise up and demand expansion of Medicaid to save our hospitals. Yes, sir.
One of the main concerns about rural hospitals, and you hear a lot of feedback, that most of the individuals who go to those rural hospitals are not paying taxes that are in the community to help substantiate those hospitals. And that's when a lot of the citizens in most of these rural communities who have been fed that information don't support rural hospitals no longer, because they feel like the majority of individuals going to rural hospital now are people who are getting a free ride.
Anybody who buys any consumer good that's not food or medicine in the state is supporting rural hospitals. Because Texas has a very regressive tax system with sales tax and property tax. And it is a lie that our taxes are lower than states like California. They're higher for lower income and middle income people because everybody's paying sales tax and everybody's paying property taxes, whether you own your property or you're renting. And it's part, what if I see the Republicans' modus operandi, their MO, they make it up. They lie about the facts to get what they want, even if it hurts their own people and their access to health care in rural Texas. Yes, ma'am.
Just recently, this past summer, we had a thing on our ballot about trying to bring in a new hospital and whether it's private. The hospital, whether it's going to be private. Do you think your office would be more able to help if the hospital wasn't owned by a privately owned source rather than county? And if you did, what could you do for Madisonville or Madison County to help either get us a new one or save the one we got, which is basically been
We
condemned?
absolutely need to be looking at new economic models, and it's not just expanding Medicaid. 100% private ownership, private run ultimately doesn't work with healthcare because the goal is to make money for shareholders and not take care of people.
Mhm.
So the government's role is to make sure everybody's taken care of. And maybe that's through hospital districts, maybe that's through cooperative setups for other auxiliary services like EMS.
Mhm.
And being able, that's another issue in rural Texas, the EMS systems are often not there at all or.
What is
floundering.
that, MS?
Ambulance,
EMS.
Oh,
emergency medical service, transportation.
Excuse me, I'm just.
Sorry, no, that's right, thank you for asking. And, you know, where I've been living in Alpine, the distances are so far, helicopters are often involved, and the cost will put someone into bankruptcy. So people don't go get help, they'll fix their own broken bone, or throw somebody in the back of a pickup and drive them 2.5 hours. Because it's too scary, you know, tales of people having bills that are $10,000, $20,000 for a helicopter ride. That's wrong. So part of that, what I envision at the office when I'm elected ag commissioner is the big map on the wall. How do people get to their hospital? Where do we have gaps in emergency medical services coverage, ambulance coverage? And is there a way for the state to fill in those gaps, whether through a public-private partnership, completely public funded? I mean, everything's on the table. We have to fix these problems, and we have to do it by looking at the data, looking at our resources, and putting together a solution.
That sounds awfully reasonable to be done in Texas.
I know, it's like crazy that way. I like to use logic and reason and facts to solve problems.
So you mentioned the hospital district, and, that's what they was trying to bring in here was a hospital district. But
And
I
the
think
vote
it
failed
was
because of people saying,
that their taxes was gonna go up, you give your own, all the money is gonna come back on us, that's why they didn't trust
no,
that it wasn't gonna be, you know, that they didn't have the funding to do it on their own.
you know, a part of the role of this job is a lot of persuasion. There's things that I don't have power over, but I can persuade. And as the job of the advocate, figuring out those political solutions certainly fits into that. And making sure when there are votes in these smaller communities, somebody's paying attention to help and not just the naysayers and the local Republican operation.
I know when I first moved here, the hospital was a county hospital.
Yeah.
And we had a judge at that time who ran as a Democrat, was elected as a Democrat, and then flipped to Republican. And convinced everyone to sell that hospital to St. Joseph because the county couldn't
For a
afford
dollar.
And I bet it's been bought and sold
to
more
take care
times
of it.
since. Yeah,
No, it's still St. Joseph because St. Joseph can't unload it,
yeah.
but they haven't put any money into it either. And so, I
It
guess
rots
if
on
it's
the
been
vine.
condemned, that would be why.
It's the same all over the state. Outside corporations buying the hospitals, not taking care of them, and then they slowly deteriorate because they're not safe.
But we even had one of those emergency centers open up on the highway and it couldn't make it.
Yeah, to my memorial, my scale memorial,
Is that what it was?
yeah, out there by Buc-ee's.
Uh-huh.
Yeah.
A standalone in the yard that looks like an urgent care but charges you a lot more.
Exactly.
Yeah. Great. More questions? We all good? Yes, ma'am.
I don't know if this is relevant, but does, in a lot of rural areas, it seems like we're getting things like solar panels, and if you go up into the northern Texas and Panhandle, you have the wind farms. Does that fall under your aegis? It does affect a lot of people in rural areas.
It could within economic development, but it is much more under the Railroad Commission, which really should be called the Energy Commission.
Of course, yeah.
Because it's nothing to do with railroads, and a little bit under the Public Utility Commission. And then also infamously ERCOT, which manages the flow of electricity.
We all
in the grid.
Yeah.
Yeah, nobody knew what that was until it freeze last year.
So how would that, if you had solar, how would that affect broadband? Or would it have an effect? Would it help it or would it?
I don't know that there's a direct connection aside from stability of energy.
Right,
Because if the electricity goes out, you lose your internet too.
right.
And the best, and I'm getting into Liv Warford's territory, but I know it from hearing it so much, who is our railroad commission nominee. And the best way to provide energy is with a mix of sources.
Right.
With wind, solar, and now geothermal, and that actually is getting into Jay Clayburgh's territory with the land commission, because he can lease public lands to provide energy. So he can decide, are we gonna go solar, geothermal, and if we are gonna do oil and gas, and there's a lot of subsurface mineral rights the state owns, we don't own the surface land, he can demand they do things like not flare methane to exacerbate climate change.
All right, we will take one last question.
And I'll say while y'all are thinking, if you have one last question, one fantastic thing about this ticket, two fantastic things. We all want to do the job we're running for.
Right.
We're here to do the work, not have the title and not have the springboard for our political careers. Second, we all work together, collaborate, and to really solve these complicated problems like energy, water, the drought, you have to work together across multiple agencies and with the legislature. Because one office isn't all powerful, and it's all interconnected.
That's why it's important to vote Democrat down the whole ballot.
All the way down.
There it is.
All right,
Any last questions, or are we good?
I think we're good. Susan, thank you so much for being here today.